It was not.
Six o'clock, this is the Board of Directors meeting for North Gillum County Health District for March 17th, 2026. So we have a quorum. Additions and revisions to the agenda, we're going to add on old business, Stacy contract, E will have, she wants to defer to April for that. A new business, C will be streamlined. Whatever that is. D is GIP authorization for Joanne to be added to account. And I've added E. So in April, we should be filling out ethics paperwork. Is that not right? Is anybody?
Anything, I've never done anything, so
Okay,
maybe that's
well, I
fine.
guess I'll have to look into it.
Yeah, because I know what you're talking about, because there's a class that every board has to take once a year. And is that what you're talking about?
No, this
Oh,
is,
this is
this is
different.
paperwork where we have to put down our relatives and stuff. So that
Oh.
we don't get ethics violations against us or they can't do anything on us.
Oh, I don't
You've
know
never,
about that.
nobody's ever done that?
Mm-mm.
Okay,
Yeah,
well, I'll
Look
have to
into
look into it then. Good,
Can we also add the ambulance financing?
new business?
Yes.
Ambulance financing.
Good Lord, my brain doesn't function where I am.
Okay, so. Anything else for,
I don't have anything.
good? So we'll move on to public comment. Do we have any public to comment? No?
Well, I would, but I see that it says that, you only hear public comment on items that are on the agenda. Is that true, or is that just
No.
what was written on your agenda?
It's just verbiage.
That's just verbiage, okay. Okay, then I do have.
We'd be happy to
comment.
hear from you.
I am Kelly Smith. I recently moved to Olex from Condon, and I'm running for county treasurer. And so I'm kind of just touring board meetings, getting to know our board members of our taxing districts. If elected treasurer, I will work with all of you on a pretty regular basis, turning over tax dollars, SIP funds, things like that. So I just wanted to let you guys get a face to go with the name, and I'd be happy to hang out afterwards and chat with anyone that would like to talk. That's it. Thank you.
Thank you. Okay, any other public comment? Okay, move on to the consent.
nobody.
I have nobody online.
Nobody's on? Okay. Let's move on to consent agenda. So. Has everyone gone over all the minutes? Because we have December, January 20th, January 28th, and February. So okay. Is that what you've got? Yeah, February 17th. To accept. Then I'm assuming that we need to do them one at a time?
I think we can do them all.
I'll do them all, just,
Do them,
I just move to approve the consent agenda. Do them all.
okay. Been moved to accept the consent agenda as is,
Let's second the motion.
and it's been seconded. Roll call vote.
Aye.
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 Aye. Aye.
Okay, motion carried. Okay. So the minutes and financials are done. Department reports.
That's very fast. I just wanted to make a correction to the January patient numbers, that I went off of. I went off of what was there and I went back in the computer and instead of 170, it's actually supposed to be 152. I didn't look at all the cancellations. I had been a while since I looked in there and saw the different colors, so. Then other than that, James Metzger stopped by this week, wanted a copy of the audit, said that our website is out of compliance. That's why I threw Streamline on there, so I'll talk about that when we get to that on the budget or further down the agenda. I reached out to Project Happy Face. It's a mobile dermatology unit. I just spoke with her tonight. She's gonna be calling back. We're gonna co-op with South Gillum Health District. They're gonna go there one day and then stay down there, come with us the next day. She'll see about 20 patients a day. It's at a free service, does skin cancer tests as well as treats for acne. So the only time it would be a charge would be if they're billing insurances for a medication. Otherwise, it's a free service. So she's gonna come, she may be able to make it for April, but otherwise it'll be like the last weekend of May and then the first week of June. But she's gonna hope to come like every 3 months on a rotation.
It's free to us, but somebody must be paying for it.
She gets, yeah, she gets grants and stuff for that, so, yeah. Public health and WIC were in the clinic this month. They had a great turnout for the vaccinations for the school. I don't think anybody missed their appointments. I think everybody actually showed up, so it was good for them, kept them busy. We did have 2 patients that came in stating that they have balances, but when they called their insurance, we gave them the dates back on their billing for the past year. And both of them, insurances were never called or billed. This is the only 2 that we know of that have came in so far. And no claims were made. We did bring it up to HSA, who is our billing company that took over last February that I saw in an email here that I brought. So I think they're starting to dig in and do a little bit more research on that as well. Okay, so just something to be in the forefront of your mind that I'm sure we're gonna have many more. That's just the icing on the cake. There's 2 that were, one was $760 some and the other one's like $1,400. But nothing was ever sent out to his insurance, and some of those are already reaching over the 1-year mark, so we might be out of luck with some of them. We cleaned out the storage units, so saves us $50 a month. Clinic patient count for February was 142. We had the providers out for 3 days, total of 17 days of coverage. Joyce's average was 5.8. Steve was up to 6.3. HSA payments reported from July 1st currently is the 40,767.53. We didn't have a provider on Monday. Stephen was on vacation in Hawaii and got rained in, had like a foot of mud. I thought he was joking when he called, but he said the tow truck needed a tow truck to get him, so hopefully he flew in last night. I haven't heard anything yet from him today, but we stayed open. I mean, we still saw people on the nurse side, but had to move everybody over and everybody was okay with it. We're working on the credentialing for Stephen and Joyce, as well as setting up the accounts for the insurances. We had not a lot. We had a couple letters come in the mail saying that they're terminating services. I spoke with Steve and he got on. I guess Joyce said that normally Michelle does their credentialing. He keeps up on that side. And when Steve logged in, he was kind of frustrated because it said no one had tested anything in 189 days. So we got everything approved. We just waiting for him to sign back in when he gets back to the final okay. And then so we've been calling, trying to see what we need to send to everybody to get all that back up on par so we don't lose out on any more insurances. EMS, 13 calls, 5 transports, 8 non-transports. We had 1 life flight, 1 mutual aid that turned into a life flight. That one was actually a weird one. We were coming back from our basketball game and it was at the T-Bone restaurant over there in Rufus. And the page went out and I happened to be not even a mile from the exit. And I was like, well, that's weird. Why are we getting that? So we went off the road and I got on and called dispatch because I was like, why are we getting this? And Laurel and Matt were on their way, but still 20 some minutes out. And I went, checked on the guy and realized that it was a little bit more necessary to get there faster. Well, they were gone to a traffic accident. That's why Sherman wasn't responding right away. They were en route, but we were able to reroute the life flight to us. And so they showed up and then within minutes, it all worked out perfectly. Life flight was able to land and we got the guy off. So it was really cool. And then Laurel and Matt came around right as we're like, oh, we're good. We don't need you anymore. So pretty funny, but in the right place at the right time.
Yeah,
Payments from last fiscal period for the ambulance, 59,094 and a penny. Still have some missing for May. That's the only ones that were missing, and then I think that can be cleared out. I'm not sure why. I've talked to SCW a couple times about that and the missing payments. It's gonna be your red and blue first page. Current billing for this year is 56,690.65. Total collected the fiscal year to include the back payments, up to 98,490.82. Sleeping quarters is almost complete. The electrician comes next week and then we will be good to go there. Everybody's loving it so far. Staff went up to Chem Waste for a luncheon tour with Lacey last week. They did the little tight site tour and I think law enforcement, fire and all that was there. And they talked about all the things that happen up there and the guys seemed to really enjoy it. And then tonight, the crew's training with the fire department for a traffic incident management training. So good things are happening.
Quick question about, remember, I don't, but, we did something with Life Flight and Tri-County and.
Yep, fire med. So that's gonna be the switching over Tri-County to fire med.
Right,
So I actually just talked to Angela today. She called me because I had wrote her and I said, hey, I need that final contract and then so we can get the flyers out. She said that they actually wanted to change the date to starting April 1st to be the effective date instead of back in January. I think they're working out some logistics. And so I wrote back and I said, yep, absolutely. Just let us know when everything's ready.
so then we will send out flyers, is that it?
Yes, because they're gonna automatically switch them over from Tri-County into the fire med. It's all, I think, gonna be running the same office. It's just the name switching basically, and then the area.
So if a guy, myself, wanted to update, or renew
Yep,
Life Flight membership, do you do it through the Life Flight
you can do it at the
mechanism,
clinic.
or you go through, huh?
We do it at the clinic.
Oh,
We
you
have
do?
the applications for the clinic and then they actually have, if you buy the two, get the two, you don't buy the two, but if you sign up for both of them, then you get like a $5 discount. Yeah. But then anything like even if you were to sign up today and it went, they're gonna automatically transfer you over anyway, so.
Sure.
Yeah.
Okay.
But we do life flight and all that down at the end, or clinic too,
Oh.
both places.
Thank you.
You're welcome.
Thank you.
Sure.
So, moving on, old business. Did anyone have any questions to Stacy? No?
On her reports,
Yeah,
no,
okay. So we'll move on to old business. Do we wanna readdress the clinic employee departure? Did everyone see the letter that?
I know, sorry, I just emailed that out today. I don't know how I missed it during the week.
I have not saw it because I've not been
Okay.
able to get mine. Is this one from Andrew?
No.
Yeah.
the-
You sent it, I think, to me, forwarded it, I just forwarded off to the rest of the board.
Oh, okay,
Yeah.
'cause I received something from his. Forget her name,
Gone.
Yeah.
Oh,
yeah, and I don't know, something and I said, hey, I thought this was gonna be done a week ago and. I don't recall everything, but I thought, my comments was, I thought there was gonna be a little more teeth in it. And I had not heard anything and I didn't know if
Well-
anybody else has heard anything.
This was what I got out of it, that what Michelle sent back. Was she was trying to cover herself a little bit. But the second letter was written by someone who is very articulate and knows what they're doing. I personally, I do not believe it was Michelle. But this second letter and stuff covered a whole bunch of stuff. And I'm not sure that even Carrie has the wherewithal to do that type of a letter.
This was a response from Michelle.
This was the second response from
response.
Michelle.
Okay, I guess I haven't saw it all.
I wonder if we need to go into executive session. I think you need to look at that communication. And I'm not sure about what that might lead to, some action that would not necessarily be public at this junction.
Okay, I had, like I say, to the date, I didn't know where we're at, so. I just.
Do you have that?
I can pull up you.
Okay. Do we wanna do it now?
You're the chair, whenever
Okay.
you say.
Well, why don't we do it and get it over with? So. Executive session will be called in accordance with ORS 192-662H to consult with legal counsel. We don't have legal counsel.
No, but it. has to do
Okay,
with-
this is going
This
with
will
the,
lead to it.
okay, concerning the legal rights and duties of public body with regards to current litigation or litigation likely to be filed. So,
Let me
So we're doing. Care about this. So what, do you wanna make a statement or not?
Yeah,
I'll get a contact, send a notice to Andrew or. I'll send it. Yeah, I'll just keep it real basic. Response. Did you give a text?
so. The old business clinic employee departure. I will contact our attorney.
How much of that is?
And ask him for direction as well as give him what we feel needs to be, we want to have done,
Or to.
What we discussed,
what we discussed. Okay,
no action was taken.
right. Okay, no action was taken. Yep. Good. So, move on. We've discussed the rural health clinic, didn't we?
No,
Not really.
Not really, okay,
Where are we?
well,
We're nowhere.
so. Stacy met with.
Honora.
Honora. And it did not go well.
I just don't think it went anywhere, really.
I was there.
Oh, okay,
I wasn't sure where she stood when she left, is all. She
okay.
asked a lot of good questions and, but, yeah, I don't know where we ended up with that.
I haven't heard her where I sent her a message and she never replied with anything.
So,
So.
Okay.
Do we have anything, like, do we have like a posting or anything on that, or?
I haven't yet because at this point I was just waiting to see what we
Okay.
wanted to do.
We
We,
just didn't know.
we need to hit as many places as possible. Cause if we wanna get the rural health up and running and stuff, we have to have somebody here.
well, I think we want to talk a little bit more broadly about the rural health, right?
I think so too. Is it really gonna be that advantageous to us?
That's-
That's my question.
That's the question, I look at what probably is down the road in terms of medical services delivery, and we found out through COVID that we can do it virtually in many instances. And I think that I hope we've convinced ourselves it's very difficult for us to get a physician or a PN or NP or whatever, I don't even know the terminology, here in River City. And, the rural health clinic demands that we have, not only in town, but in the on-site. And I'm not so sure that we're gonna be able to afford or accomplish it even at no matter how much money. So I think it behooves us to kind of maybe take a pause and investigate if that's really gonna be money wise for us to go down that path. And And just because it seems to me that, what is it called?
RHC,
R-
RHC. That one,
no, the folks that are doing our
HSA.
HSA. HSA hasn't been a really good friend of the family thus far. I don't think they've been doing the job that we paid them to do. We continue to pay them. I just think it warrants a reconsideration.
Well, I think, we need to weigh our pros and cons. What is it gonna cost us to have someone fill that gap that needs to be filled to have the clinic staffed as RHC demands it be? And then what is our community's response to having an RHC? Are we gonna bring in more patients? Are we gonna be able to bill more? Are we gonna be able to cover those costs? Is it gonna bring more money to the clinic? Is it really a positive or is it, I
Well,
don't know. I don't know. I don't
because
have an answer.
Oregon has, declined federal assistance and stuff, the monies are not gonna be there like they would have been.
That's another consideration. That's a big consideration. We don't know what,
So, and that's what the deal was that we were supposed to be able to bill more and get more money because we'd be paid for it.
Through Medicare and
Yeah,
Medicaid, which we don't know are even gonna survive
Yeah.
for the next year.
Right. So,
so we might be
Yeah.
dancing to music that doesn't exist.
and we don't know what Joyce's plans are.
My only thought, and you discussed with me a little bit, you'd have that discussion with her, she was. Even, let's say even if we hired somebody now to fill that position, she stated to Stacy, she would still be willing to try to fill in or do whatever. And I guess for right now, as long as she's willing to do
Yep.
what
Yeah.
she's trying to do with the telehealth and, yeah, I'm good with that too, but I think the other thing is we don't know, I agree, but the long range, I think it's something that I hope that we can keep on the board. She's got a lot of other irons in the fire.
Mhm. Yeah, we have other things to
Or president.
concentrate on.
Yes, I agree. But the other thing is, I forget what the county, there was a county grant specified for that too. I
Yeah.
forget the
24,000 something.
What was that?
They gave, the county gave 20, I think it was 24,000.
Something like that,
five
yeah.
to nine or something.
24,000 for just the RHC
Yeah, so we'd have. to-
certification to get there, to help them get there. But, so,
We don't know how much has been spent on that. I don't know what the money was for. To,
It
what
was.
were the costs
Yeah.
to get an RHC?
How much do we have a contract, do we, with HSA?
We do, they sent it over, I can get it to you, cause we had asked, huh?
It's expired.
Well, yeah, it started over a year, so they started back in. It was only supposed to take 6 months to get everything in, and even when we talked to them on Monday, they said, well, you don't know anything yet. Because it doesn't really, they're trying to get us all the way through to completion. But right now, because it's been so long already, over a year, we have to go back through and update all the information, like we already have to do all the meetings, like all the big plans, like all the things. That are included in it, and then send it all back to them again to start over.
And the whole,
she started at 24, I think.
Yeah,
so the whole reason that HSA took over the billing was because they were gonna be our RHC.
well, so I found this one, Carrie had from a staff meeting from 3/3/25, and it said. Where is it at? Today at 1 PM, we kick off our call with Health Service Associates beginning our RHC certification process. We will learn to the next steps today and what they need from us. This will be a 6 to 9 month process to reach our RHC certification. This will depend on how quickly we're able to provide everything they will be needing. But she had said, sorry. Also, on February 1st, HSA group starting our medical billing. Now that Michelle is back 3 days a week, we'll be having a call to discuss the billing and get a better understanding of what she is doing versus HSA. Billing company uses the iPatient Care software. as 2.1 statements are no longer through ECW. I don't know.
I remember a time when the board contracted to have some services rendered that had been provided by the administrator. So that the administrator could focus her attention on RHC.
Yeah.
And then subsequently, we contract for somebody else to do that work. This is just not.
Both of them got close to was my.
Yeah, we had one
All the
more,
time.
one
It's
more,
always the fiscal.
Well, I remember saying that we had the green light, but we haven't even gone through the final walkthrough to get the okay to do the
right,
final thing before we can go to the state to have them come do our survey. So we're at the same spot we were last
Yeah.
July.
what gets me is in Carrie's departure letter and stuff, she said that she had got RHC finalized.
I have the whole packet right there. Got everything listed.
I just think the real obstacle is our ability to land and keep a physician or,
The staff,
or a
the
medical.
necessary staff.
Yes,
Yeah,
and if we are designated and we can't get the staff, that designation doesn't do us any good.
yeah, cause if we got it and then lose that person, then we're not there.
Right.
Yeah.
Right, whereas, with the virtual, we could have a physician, I say this, we could have a physician in Cucamonga who comes on and does the virtual. And we contract with XYZ Doctors Group to get the benefit of their delivery. And I think we have to not try to second guess what the feds are gonna do as much as it causes angst to think about it. But I think we have to do what seems to be right for us at this point. And trying to read the tea leaves as best we can from our standpoint. I don't even know what the process is to reconsider, but I just think that going down this path isn't getting us anywhere.
I thought that we had paid $17,000 to HSA to do the rural health. I remember seeing something about
That might have been like their initial one, but it was, I know, like when Tressa came and stuff too, there's additional monies that were on top of that.
Okay. I'll have to go back through the minute.
Yeah.
Fine.
And we also have, I mean, Mortensen's coming back, like we have, we just did like 14 UAs all in one day. So that's the nice thing of all these, with everything that's
That's true.
coming over here, it might be nice. The only bad thing with that is that Joyce can't do DOT physicals. But if we can schedule them on Mondays and Fridays and Steve's here, like, we can still rock out all the UAs and
And our
that's
fee
85
structure has
bucks, so,
changed
yeah.
also.
Yeah.
So,
Have we paid them more than 24,000?
well, we're paying them, anywhere for billing. This last month it was over 700. Last month was 500 something for their billing.
If we're able to segregate that, I want to make sure that if we got 24,000 from the county to do this.
Yeah.
That if we've spent the 24,000,
Trying
we
to
spend
do
it on trying to do it, not that we spend it on payroll or
Yeah.
or the process.
Operation.
Exactly.
Right,
It's not
right.
operation.
No,
I don't think the county's gonna ask us necessarily, but I would want to feel comfortable.
some of us might hold us accountable,
Yeah,
mightn't we?
And there is a final report
Yeah.
when grants received,
Yeah.
that you do need to lay out,
Yeah,
but it's done.
yeah, I like the ambulance one, that was another, the orders. And, yeah.
Good. Anything else on it? Will we move on?
Well, let's give Stacy some direction. I think we've just left it up in the air. What is our direction for Stacy? Do we want her to stop making an effort of any kind and focus on what's really important to us right now? And then we'll look at it later again? I mean, because we're,
Yes,
is that
Yes.
our consensus?
I think that's a good thing to do, because also, gosh, they can put in for an extension to the county.
Yeah, people
So,
ask for extensions.
Well, another 12 months or something, or-
Just
Whatever
depends.
you think you
It
are
kinda-
gonna need to
Yeah, just depends.
wrap
so,
it up, yeah.
so I think we keep it on the board, but we gotta make sure that that money that came in is for that. And if we use it for it, then we use it for it, and we can, but it's not a priority right now, yeah.
We got other things too.
Okay.
So
We just need to
make that
focus
basic for you.
and that will free you up for
other
some
things.
other.
She'll have so much time now, no.
Yeah. Yeah, I've been down there.
Or a computer at me.
I'm gonna throw her computer.
No, you guys' plate is plain full.
Okay,
Okay, thank you. I just wanted to clarify what
okay,
we were saying
You're
there.
good with that, Stacy?
Yeah, okay.
Okay.
so. Old business C, budget work session.
We had one.
Okay,
We did.
Would you like the time?
You want me to try to summarize
Yeah.
where I think we are? Well, just cut to the chase. Remember, in this year's budget, we have, give or take, $400,000 that's unappropriated. That was the money that used to be in reserve funds, moved to the general fund as unappropriated, so, our spend rate is, give or take, it approaches $100,000 a month. So the next time we get an infusion of funds is gonna be in December. And that's gonna be the tax payment. So we need to have the ability to carry on for a 6 to 7 month period. That's $600,000 to $700,000. We don't know exactly what we'll end up carrying out at the end of this year, but it's probably going to be in the area of $300,000 to $400,000. That's just a guess. But that certainly is not enough to carry us for 6 or 7 months. So our discussion is that we're gonna plan to move that $400,000 from unappropriated into the general fund for use. And as we might contemplate going to the county for operational funds, they have those kind of grant applications. But if we were to put ourselves in the shoes of the county court, how would it be for an organization to come to the court for operational money while we're sitting on $400,000, as it were, in the bank? So our inclination is to move that 400,000 into operational use. We know that next year is gonna be a relatively lean year, followed by a pretty fat year. That's what we're told. So unless, and the way I look at it is, unless the county says, here's some money that's dedicated to our kind of service. If they were to do that, then I think we would want to consider making application, because it doesn't make much sense for the county to put out something that doesn't draw some kind of interest, if you follow me. So that's kind of, I think, where we ended up. We just had a little confab with Stacy, and we were intending to meet Thursday of this week, but we're parlaying that to Thursday of next week. And our hope is that in April, when you guys meet in April, I won't be here. When you meet in April, that you will first meet as the budget committee. And perhaps even in May, you'll have the opportunity to approve a budget. That's kind of
Yeah,
what I think we are.
I'm thinking with what they're doing now, and they're really Just seems like the clinic is so much more busier too. And I'm hoping with the additional resources coming in, that we can get to December. And,
That would be
pretty,
nice.
pretty confident, I think we'll be able
Yeah.
to.
Yeah.
And if we don't, then we'll see where we land. We'll go from there.
So with that being said, we've also covered the operation grant.
Operation, right? Yep,
Oh.
yeah,
Well, unless the balance of the board sees differently, but
We'd really like to make it without having to ask the
Yes.
county for money.
Yeah.
I mean, it's just
But we don't,
embarrassing.
you don't, like you say, you don't, that would be not good to go to request some and have us sit here.
No, yeah.
Yeah.
No, we have to use our own money first.
We're headed in the right direction
Yeah.
with everybody, the work that they're doing.
Yes, we are.
It's gonna be good.
We're gonna come out on the other side.
Yes.
okay. Stacy's contract, we're tabling that until April. She's happy with the contract she has right at the moment. Okay. New business, high school scholarship.
So I pre-typed the scholarship. We actually had one person apply already, but it's right there underneath the letter for Joanne. And I'm gonna send that up to the school so we can get someone for the 3,000 again. And hopefully we'll have it ready for, I think that I put on there for the May meeting, I believe. May 16th deadline.
This is the scholarship application.
Yeah, that's just the prereqs on what we have wanted, and I went off the one. for
Okay, so
previous-
Miss Moore is gonna have to redo hers.
Yeah. Probably.
Okay. Cause I took up the Lions Club also today,
Okay,
and she was in the office there.
okay,
We
yeah,
had a little discussion, so,
oh. Perfect.
okay. Yep. Anybody else wanna look at this?
See if they'll change anything.
Okay. And that's the only one we've really gotten, so.
Yeah.
She put one into the Lions as well, and, yeah. Okay. B, clinic credentialing and billing. Kind of went over that, didn't we?
I did. So we'll move along to streamline. So James Messer came in, basically said, let us know that our website is out of compliance. I did go on there and I'm not sure. I changed some things. I got rid of the stupid video that I was playing in the front and actually put up a wheat field or where that's for Arlington, not an AMR ambulance. It's driving me nuts, but anyway. I went on and then I found out we got an invoice from them and so we pay them $600 a month for Streamline for our webpage. And when I started talking to everybody else in town, some people pay $20 for GoDaddy, some pay, well, the fire department has Streamline, they don't pay nowhere near $600. So I did open a ticket today to try to get on there to figure out what we're paying for, why is our website out of compliance, and 15,000 other questions I typed in there. I also, I went on and I don't know when it went out of compliance, if it was ever even in compliance.
What does compliance mean?
There's just a lot of exclamation points for like governing board, like it's missing a lot of documents. So like when I look on South Gillam's webpage, like they have their request for information, they have like the governing the ORHSs and all the codes on there for what you would normally need, and ours does not have. I don't find it on our webpage at all. So I don't know if it was ever done or not, but I'm on.
It has been, it's just been budget minutes, meeting.
Which if we're paying $600 a month,
A
we
month?
can go to GoDaddy for 20.
That was possibly included in that Google thing that you checked the number.
Well, that was $18 a month,
Yeah.
but that was just for the North Gilman County Health District domain.
Domain,
name.
yeah, it's just,
And it's a static website, there's no interaction.
Yeah,
$600 a month.
$600 a month.
Mr. Metzger, did he, so I know that like, the audits were usually posted and stuff, but, I don't know if there's a ORS. I don't know. I'd be kind of interested to see what these are. But like I say, my recollection was, your budget, your meetings, the agendas, all that, financials on, public.
Yeah.
Public information that they could get on. But,
Mrs. Smith, can you give us any background on that? I know you dealt some with the IT
I
at
don't-
county.
I don't know if there's any like special things for a medical clinic. I don't know
'Cause it's
that
different.
part. I do know there's new ADA requirements for websites. But that was all kind of really becoming a big deal as I was getting out of the IT business, so.
I just find that interesting, an employee for the port that was out of compliance for 3 years. Is worried about our audit, and I know I followed up on those, Secretary of State. Make sure we were all up to date, and we did it in December. Our last audit, it's not on our webpage. If you want copies or hell, send him my way and I can email him now. I can email.
He did come down for the copy, but the one copy I had in the office I was using for our budget, so I asked him if I could. I just haven't had time yet.
Yeah.
He just
You want
asked
mine?
verbally.
Mine
He
down.
didn't fill out like an actual paper request. But
That's just,
But once again, it is, our website, is compliance the right word? It's out of compliance?
Mhm, because we're a
Compliance
public
with
entity.
what?
Well, it's federal regulations.
Yeah.
For one, and state probably regulations for another. There are certain things that have to be on websites and ADA stuff for sure. Because everybody has to be able to have access to it. And then how we post our agenda and our minutes and the things that we include or should not include. I mean, there's a list of things.
Oh, okay. Well, I just thought people had websites if they wanted.
yeah,
Huh. But if you're a public entity, then you have certain criteria you have to.
and so we were looking at that too. I did fill out some forms, but I didn't get done with all of them. But like also like a fee schedule too for people if they are requesting all these things, and then we have stuff what we're doing to go get them the information, then we can charge them also fees accordance with Oregon state law too.
Yeah.
Do that.
I think if we're paying that kind of money that they would,
Make sure we were in
Yeah, I'm
compliance.
trying to figure out what's
you're not
included.
compliant?
Yeah.
There you go.
The county's website management group, I think they,
She uses
Well,
Revise.
yeah, we use Revise. I
Yeah.
think they do make sure we're in
Yeah.
compliance with ADA and
They
they
should,
they
should.
give us
That's
a
part of the
list
contract.
of what needs changed.
Cause I talked to Chris Fitzsimmons yesterday and we were talking about it and she actually gave me the other lady that works down there for Ellen, and I can't think of her name.
Kim,
And she helped them get theirs in compliance, so I do have her on a post-it note waiting to see. To ask for some help going forward, to change it. So,
Sounds to me like we
Yeah.
need to find out if we can get out of our contract with Streamline and do
Yeah.
something else.
Yeah.
That's exorbitant.
All that savings adds up.
Yeah.
Yes, it does. You're $50 if you're $600 and pretty soon you're at $5,000.
Well, one thing that Stacy and I talked about today. Canceled checks, do they have to be on the website and the financial? I wouldn't,
I
Should
don't,
not be.
The only thing that should be on there is your agenda and your minutes. You should not post the board packet. There should be nothing regarding your accounts on
Yeah.
there
oh,
at all.
yeah. And I don't want them in my packet either, cause I don't care about the canceled checks and
No.
bank statement. I wanna see what our profit and loss statement is.
Yeah.
Looking at those checks and that checking, I don't look at my own bank statement, cause I have I use
well,
QuickBooks.
you must have a lot of money.
I use QuickBooks. I don't have to. I tear my bank statement up and throw it in the trash, cause I go online and look.
well, we're working on to AT&T too. I mean, this is off topic, but still saving money. I went on there, back in January, I tried to go change this out of we got the phone. So the providers used to have a phone for on snow days or whatever, they would take the phone from the clinic and then they would use it. I got the phone back. It doesn't even turn on. Cause I wanted to go through our bill for Michelle, cause it was like $267. And I was like, geez, this is a lot of money. Cause we use it for the iPads for the ambulance. But we only have 2 on the ambulance. The other, old one, I don't know why we're paying $60 for that, so I was like, nope, take that off, and then there's two other $12.98 charges, and I was like, nope, don't need those. And then the phone, I tried charging the phone all day long, they wouldn't do it, that's $99 a month, so that's not even being used. Grant tried to go to the AT&T store, cause I went, but then they wanted me to put it in my name, and I was like, well, it's a government entity. So then they said I had to go to Hood River, so I actually forwarded on to Dave Anderson to go, cause he was, going out of town, because he's one of the original people on the name on there, and I said, I don't wanna ask you to do it, but if you please could, so we can get rid of this, so we can cancel the dang thing.
Yeah.
So he said he was gonna do it yesterday, I haven't found out yet if he followed through yet, hopefully. So more money, yeah, back in our pocket.
Yeah, those are the little things that drain you dry.
And then LGIP, there's a letter up there for the board, I need to have. Perfect, I didn't know if two people need to, but it's just basically, you guys are giving us permission to take Michelle off the account, add Joanne onto the account as a user for the LGIP. Please and thank you.
Do you need a motion to do that?
I was gonna ask that same question.
Yeah.
I'm not, yeah,
I
I was
do.
like,
I
I'm
think we
sure
should
we
do
do.
that.
I move authorization.
Okay. So it's been moved to remove Michelle and put Joanne on the LGIP account.
I
Need a
second.
Second, okay, it's been moved and seconded. Oh, I was hoping somebody would sign it.
No,
Okay, so it's been moved and seconded, so roll call vote.
Aye,
Aye, gladly.
Aye.
I,
Okay, motion carries
Perfect,
and the letter's signed.
thank you.
And ambulance financing.
So I couldn't tell you when, but it must have been maybe in December. We talked about exploring some refinancing perhaps for the ambulance that we're paying pretty steep interest. And I don't know how we want to move forward on that, but in the event that the county would designate some money for emergency services. One thing that I would ask the board to consider would be asking for money to help buy down the principal cost of that ambulance. But I would be pretty ashamed to go before the court and say that we're paying almost a third as much for interest as we are for the principal. So I just think we owe it to ourselves, if we don't make any expression to the court for any reason, that we owe it to ourselves to explore some better financing.
I wonder if the SDAO has someone that can help us look into something like that.
Well, they probably, I'll check, but I would think that they would tell us that we should have financed it through government purchasing.
Yeah,
And other than that, I can ask.
thank you.
yeah, cause that was kind of. I'm thinking 24. Maybe when that happened, because we thought that the funds were there and they weren't.
Yeah,
Ambulance was ordered. And hindsight, 2020 should not have bought the ambulance. But they had already been placed. And I don't know, it's unfortunate, we're winging it, working through it, but
Why did they go to the bank?
I think that was the best route. I don't know, I wasn't the one looking it up, but of everything that I was passed on that I recall discussed, this was the best rate. And the other thing is now, I don't know what one is today, but I'm sure I think we're still gonna be money ahead, but
We're gonna be paying $500,000 for our ambulance.
by
I
the
think you're
time
gonna
we're
pay
done.
over that right now to order one. Yeah. So, well, maybe. I don't know how many more years are on that contract, but maybe we could make some additional payments here.
Well, I know the bank said that if we found another bank finance, that they wanted to have a shot at it. So, they might lower the interest or something.
Yeah,
What did
But
that
you'd have
tell
to-
you? That's just nasty.
Shot at it.
We couldn't agree more.
So I'm sharpening it now.
Yeah, right, exactly.
My
Yeah.
question is, why didn't they give us their best
Right,
when they had the opportunity?
yeah.
You know, this isn't the first ambulance we financed through them. The one before we financed through them, we paid it off early. And when we asked them for what the payoff was, because we wanted to take care of it all in one fiscal year, they gave us a payout cost. We wrote a check for that amount, and then they came back in the next fiscal year and said, oh, you owe us more.
That's a back of his story.
Deal.
Okay.
so,
Okay, so Brian's gonna see
I'll-
if
I'll-
we can find some,
I'll see, I'll look around,
Some-
see what we can do.
sounds good.
I know that I know the state, they have some kind of like purchasing pool. or-
Government
Is that what it is,
financing,
government?
that's
Okay.
where government financing
I
is.
don't know, I've never,
And usually it's a really low rate.
I don't know if, yeah,
That's where the city buys all their stuff on government financing. The county, I'm sure does.
Yeah.
that's cool, yeah.
So. Okay. Got all that? Oh, I talked about our ethics paperwork, I'll look into that. Nobody's ever. You
Never done anything like that.
Well, okay. Yeah,
And I'll look into what I was talking about, which is
we. took
Board
the
members-
class.
we did,
Yeah.
but some of these other people have not, including that guy down there that should be doing it too.
Well,
It's mandatory training. You're supposed to take it once in a,
So every
Your
year?
court, your term,
in your term,
in your term.
one time. It's very easy.
Yeah.
It's online and
Yeah,
you.
there's no test.
you
I
read-
passed.
It's hard, I thought it was harder to find it and get it than to take it.
It's online.
Well, I think because this gal sent it to us, it was easy to find.
Yeah, it's online, like.
But, and I have that and I could
Oh,
send it to
that
you
one.
guys. I think, did you send it to him too? And he didn't do it?
Yeah, see, I never saw anything where that was a requirement.
Yeah, I read it, when we were.
I knew the public meeting law was.
Yeah.
And I've done that.
It's
But,
part of compliance.
yeah,
It's a statute, yeah, I read it. I should have printed it when I read it.
compliance.
so can you send that to me again?
I would,
I'll be more mindful this time.
Did you print out the
I
certificate?
did, I printed all my certificates for Mr. Pacheco.
Minor, oh.
Tiffany's
She's a
on.
little late.
Okay. Okay, so that is end of list.
I, I would just probably adjourn. I just wanna thank everybody for everything you're doing, the staff, and you guys are going above and beyond, and our community is really fortunate.
I have to echo, I don't make it, I never have made it much of a practice to go either to the ambulance hall or to the clinic unless I had to. And I've occasioned by there in the last couple of months more frequently than before. And the attitude and the aptitude and the way you're received, thank you very much, is just dramatically different.
I think public perception is huge. I've noticed just in the,
It's
thank you for the opportunity, just in the last few weeks, people have come up to me and asking me questions, and I'm going, I answer, I'm like 6 days into this, you know. But try to explain, public perception is huge, and Stacy has made huge strides with things like the community walk.
Nice, Brandon.
And including, well, and just trying to include people and get the information out there in a more, in a positive way, because before I started, there were rumors when, for example, when Carrie left, there were people who were, she's leaving because the clinic, they're trying to close the clinic. Take a break, that's not what, and you have to So you're doing, she's doing a great job of dealing with the public and changing the perceptions of how it is.
180 degrees from Marlins
Yeah,
out.
and it's not just in the front,
Yeah,
it's down the hall and into the cubicles as well.
Yes.
You know, everybody seems to be, you know,
Very positive environment.
you bet.
Trying to make a positive workplace
Yep.
the way it should be.
but if you keep patting us, you're amazing board.
That's, you know, that's really nice that somebody would say that. You know, most people are about, that's right.
Okay,
I got nothing bad to say.
so we're going to adjourn the meeting at 7:02. Thank you, everyone.
I've never heard of some of these. With face from finance.
For some reason, the transcript was. Oh, no.
Yeah.
I think the trans-
Watch that so much.
But how do I delete it?
Ask
I've never even had.
Because I tried to pause it. Hey,
Kelly,
David,
Minutes, agenda.
it says something about, is it, I don't wanna.
Well, how are you? Good. Very good to see you.
Yeah.
Good to see you.
Yes.
Don't see so much of you, no basketball.
I'm trying to figure out, I don't know why, I don't know if the transcript.
Yeah,
and then
yeah,
the
no.
question
Yeah.
Did not.
He's really.
Hang on.
In April, we'll see.
I'm gonna be 7 months. Okay.